Hello everyone, myself Dr. Tapas and welcome to our channel on behalf of Physiomax Educational Hub. As for the educational purpose for the field of physiotherapy, we are making this video, and our today's topic is tenderness grading. It's a very important clinical assessment that most of the physios used to do for their daily practices. But most of us used to get confused how to grade it and what exactly the tenderness is. Again, sometimes we used to get a confusion between the tenderness and the pain. So today we will learn what is exactly a tenderness is, how it is differentiated with pain, and how we will to grade the tenderness. Come, let's see how we will grade the tenderness and what is exactly the tenderness is. Tenderness, it is a condition where the patient is to have a discomfort. That means it is a discomfort that is elicited by the patient. But sometimes we used to get confused, is this the pain or the tenderness is same? No, pain and tenderness is not same. Pain, it is a patient's own perception. That means the patient sometimes they used to tell by themselves, I am having pain over here. That is patient's own perception, that is pain. Then what is tenderness? Tenderness, it is a discomfort which is elicited by the patient, or it is a discomfort by the touch or the pressure when the therapist will touch the area or the palpate the area. So that is what is called as a tenderness. So before we understand the gradings, it's always important to understand that tenderness and pain not same. Tenderness, it's a elicitation of a pain when it is palpated by a therapist. Pain, it is a patient's own perception, and they used to tell by their own language that I am having a pain and this type of pain. So that is the difference between the tenderness and pain. Now we will learn what all the grades of tenderness is. Before we perform how the gradings is done for the tenderness, I will tell you the gradings as first. The tenderness grading, it is graded using a scale of 0, 1, 2, 3, 4. And sometimes the 0, it's not used as the grade 0, it is no pain. So the whole tenderness grading is divided into the 0, 1, 2, 3, 4. And the grade 0, that means there is a no pain. That means the patient does not have any sort of pain when it is palpated over that particular area. Grade 1. What is grade 1? Grade 1, that is patient complains of pain. That means whenever we will be palpating the area, patient will be complaining that they are having the pain. That is grade 1. Grade 2. What is grade 2? Grade 2 is patient is having a pain and also they will winces their face. Winces, that means it's a wincing, it's a reaction of a pain. They might close the eye, they might do like this. There is a reaction of a pain. That's what's the grade 2. That means patient is having a pain also and they will be wincing their face. Grade 3. Grade 3 is whenever the therapist will try to apply a pressure to palpate the area, patient will refuse their limb. That means patient will throw back the limbs, or they will have a pain and they will not allow the therapist to touch or palpate that area. And the grade 4, and the highest tenderness grading, that is patient not at all allow the therapist to touch the area, that is grade 4. So this is how the grading it is done, with a 0, no pain, grade 1, mild pain, grade 2 pain, and patient will winces his face. Grade 3, patient will withdraw their limbs, and the grade 4, patient will not allow to touch. Now let us see how exactly it's clinically done. Come, let us see the grading. Come now, we will see how the grading is done. At first, that's a grade 0, that means that there is no pain. We will just palpate this area and patient will not have any type of reactions, that's the grade 0. Grade 1, grade 1 is mild pain. Patient will complain that they are having a mild pain. Grade 2, that means patient will have a pain and the patient will winces their face. They will just make the face like this, or they might shrink the face. That's a grade 2. Grade 3, means patient will withdraw the limbs. Patient will not let the limb to palpate throughout the time. That's the grade 3. Patient is not allowing to palpate throughout the time. That is grade 3. And the grade 4, that's the last level. That means that the area is too much tender, and the time therapist will try to touch the area. Patient will not allow only to touch. That means patient before only will move the limb. That means they are rejecting to touch the area. So that is how the grading is done for this particular tenderness. So an important topic we learned today. I thank everyone to watch throughout the times, and I hope all the clinicians and the students, they will be apply the same tenderness grading on their regular practice. And one more request, those are the physios and the medical students, don't forget to subscribe this channel to learn most of the advanced assessments in the field of physiotherapy. Thank you.